I'm Dr. Manmohan, and today let us talk about sinusitis, paranasal sinusitis to be exact. Itis means inflammation, so it happens to be the inflammation of the paranasal sinuses. What are these sinuses? What are paranasal sinuses? Where are they located? Of course, as the name indicates, it is connected to the nasal cavity. There are four on each side, four on the left, four on the right, and it happens to be in these places. Please watch. The frontal sinuses, the ethmoidal, the maxillary, and the sphenoidal. Now these are empty cavities which are supposed to be filled with air. But if they happen to be filled with mucus or anything that is consolidated and sludgy, then we have a problem. And this causes terrible irritation and stress. The usual causes for the clogging of the sinuses is mainly the mucus, because the sinuses per se, they have four important functions. One is to moisten the air that we breathe in, then to lessen the weight of the head itself, to balance the weight of the head, and to act as a crumpling zone in case one happens to face a facial trauma. And the most important one, I would say, is to help resonate our speech better. Now, when the sinuses are clogged, we don't have an easy function of all these four things. The head will feel more weighty especially when we bend forwards. This area can really be heavy. The speech, as you all know, is not the proper speech. It feels like more coming nasal. And then we feel that the air that we breathe in is not as wet as it could be. How to avoid these problems? Before that, let's see as to how many types of sinusitis or the classification of the sinusitis. This inflammatory disease is classified basically into two, one acute and the other chronic. Acute, as we all know, is something that happens quickly, maybe after inhaling some dust or pollens if you are sensitive to those. And chronic means that which has been there for a while, more than a month, year, or years. Management in Ayurveda is basically threefold, as with any other disease. Number one, to ensure that we adapt well to the surroundings. And how to do that? To ensure that we wear warm clothes which are much more warmer, especially in winter and autumn seasons. Number two, to ensure that we are not in an environment that are dusty or something that is allergic to us. Say for example, if we know that we have a seasonal allergy to pollens, then better not be outdoors in a field where in springtime, where the chances of pollens in the air is high. The way that we lie down also matters, because when we lie down, the upper respiratory tract usually reduces in its space. So when we have a problem with the paranasal sinuses, it is better to lie supine with our face up, as well as the chin slightly up, for which you need to have a thin pillow under the head. Now these are simple measures which we all can do at our homes. And finally, to make sure that our living space, especially the bedroom in which we spend most of the night, is less cluttered and less dusty. Management by Ayurvedic methods with diet happens to be, again, ensuring that we are away from cold. Avoid cold food and cold drinks, substances which are extremely refrigerated. To avoid milk products altogether, whether it is butter, cheese, buttermilk, or curd and milk as such. Food that is has a tendency to cause acidity in the stomach or excess gas in the intestines, like potatoes, eggs. These are things also which we can avoid, as well as the taste, specifically that is chili, spicy, sour and salty. These needs to be extremely moderated. Apart from these, of course, there are medicines. One of the best treatments for sinusitis, paranasal sinusitis in Ayurveda is one which most of you might have heard about, Nasyam. It is introduction or the application of prescribed medicated oils into your nostril. Now these should not be done in a manner that you can do it at home. I would advise you to consult a doctor to identify your body constitution, to see which type of oil is exactly suitable for you, how many drops has to go into each of those nostrils, and what time of the day or what time of the season it needs to be done. Oral medications, there are many, but that too depends upon the associated symptoms of that sinusitis, which each person do happen to have. So it all depends upon how your doctor evaluates the condition. Now to conclude, we need to ensure that we follow the specifics which we have mentioned, which I have mentioned about the way that we need to treat it, the way that we need to conduct ourselves. In my experience, in my clinical experience, I have noticed that, and this is something interesting, which most of us don't happen to ever think about, that there is a distinct connection, probably, between the health of our bowels and the sinuses, our paranasal sinuses. Yes, I have noticed sinusitis, which is caused by the presence of polyps, which are abnormal proliferation of the tissues of the nasal cavity, leading to growth of fleshy tissue from the nostrils, inside the nostrils, has a connection to the tendency to have hemorrhoids. Yes. And our bowel habits do matter there. So if we have a bowel habit which is slightly constipative, or if we do have a tendency to have hemorrhoids, if we have a tendency to have excessive acidity in the stomach, then there is a very good chance to have sinusitis also. So I often now these days ask people as to, when they come with a paranasal sinusitis, as to how good are your bowels, and it's quite surprising that most of them do answer that they have a problem there. So that is something which I have noticed and which I would like to share with you. And isn't it interesting? So that's all for the paranasal sinusitis today. So let's meet another day with another topic.